Hi, this is Dr. Cidambi, a psychiatrist from the United States of America. Welcome to the next edition. This is all about obsessive compulsive disorder called the famous OCD. So before we jump into this video, you know the ritual. Please subscribe and also press that bell button. All right, let's dive right into this video now. What is OCD? It's the obsession, unwanted, haunting, taunting images, thoughts. These are the things that are going to happen in the brain, and the compulsions are the repetitive behaviors to relieve those obsessive thoughts in order to remove those fears. If they don't follow obsessions with compulsions, then these people would kind of feel that anxiety, depression, the restlessness. So it kind of impairs their day-to-day activities. They get this fear of something bad is going to happen if they don't listen to this obsessive thoughts. They would even say my brain is falsely asking me to do things. They are really frustrated with their brain. But what causes these obsessive compulsive disorders? There are so many factors, but we don't know exactly what causes it. There are researchers pointing to something called PANDAS, pediatric auto neuropsychiatric disorders associated with strep throat. So they might have a strep throat, and then from there it really starts. So OCD symptoms will start with children. Apart from that, it's also genetics, like any other disease. So the genetic causes could be, distant relative, then 10% of these children will develop OCD. Or it could be if both parents are, then there is a higher percentage of the child developing obsessive compulsive disorder. So there are other reasons that might cause OCD, which will be the child trauma, psychological impact. All those things are pointing towards OCD. So we also use this word, this person is so obsessive. It's loosely used term. Basically, if someone is interested in listening to the same song again and again, couple of times, we call them, hey, he's so obsessed with this. But then that is not true. Obsession is a very time-consuming, extremely haunting, taunting kind of a feeling that the person goes through, and they have to, chase it with a ritual. That means most of the time is spent chasing these thoughts, and rituals followed with the rituals. So when we throw this word very loosely, we need to think twice. So be careful, guys out there. Don't just loosely use this term obsession. So what kind of obsessions do we see? Before we get into these obsession, what are all the obsessions? Some of those examples that I'm going to talk about. Let's see what happens in the brain. The front of the brain has the orbital cortex, and then the basal ganglia. Those are the two areas of the brain that are involved with OCD. So what happens in these areas are that there is a messenger called serotonin. When you see the brain of these OCD patients, they will have low levels of serotonin. So when we replenish serotonin in the form of medication, these symptoms are much more manageable. There is no cure, of course, but we can manage these symptoms and they can have a much better lifestyle. If goes untreated, the prognosis is really, really painful, because these people will be spending enormous amount of their time when they are awake during the day, absolutely chasing these, irrational thought process. They know that it is not true, but they can't stop it. But when it comes to obsessive compulsive personality disorder, there's another, diagnosis. This is totally different from OCD in that they will do the whole thing the same like OCD, but the personality disorder don't know that they have a problem. So they don't care. They continue to do what they are doing with the rituals, which will be impacting on people who are living with them or who are caring for these kind of patients. So it's very difficult when it becomes a personality disorder. They are not aware of it, and so they don't seek treatment. Whereas the obsessive compulsive disorder patients are aware of it. It's very painful for them, and they come seeking for treatment. That's the major difference. So what are some of the kinds of obsession? There are numerous. So I'm just going to mention a few of those. Some people will have these obsessions, the repetitive thoughts that they're going to get contaminated. The whole area is contaminated, is like bugs. So if I touch that, the germs, maybe my hands are like dirty. So I need to keep washing. That's the ritual. They'll wash, they will scrub it, and then they will use the metal scrubber and scrub it till the skin is gone, and they can even bleed and then go to touch the bones. That's how bad it can get. So we need to be very mindful of taking these patients quickly for treatment. People who suffer from this should seek treatment as soon as they can. So these people who have this fear of contamination can take it to a very painful level. The next thing that with OCD is that some people, there are thoughts of sexual content. Probably they might think, oh my God, I have thoughts of hurting this child sexually. And so they have this fear. They keep thinking those images comes up. And so they always think, oh my God, I might sexually inappropriately hurt this child. And so they try to avoid getting in contact with children. They'll be constantly beating themselves up. So that is another kind of sexually oriented content. It could be with a spouse. They might think, oh my God, I'm sexually hurting them. And then that could be their obsessions, and there'll be rituals that they will follow by avoiding them or doing things. Then comes the counting. So they might say, oh, if I don't count it in certain ways, then something bad will happen. So they'll like start counting 1, 2, 3, 4, and then they have to like do three times spitting or something like that. So these are the obsessions and compulsions. If they don't do that, then that means something bad is going to happen. Then they will get those anxiety feelings inside. They could be hoarding. They cannot get rid of stuff because they'll think, if I were to throw it away, something bad is going to happen. And they might even be taking responsibility for bad things that's happening outside. Oh my goodness, if I don't do certain things, I'm the reason why that person died. So they would be blaming themselves. It's a blaming kind of thought process. Then that's followed with rituals. So then can also have religious content. They might say, God is going to punish me because I did not pray 5 times to God today in the morning. So they need to do those rituals to pray 5 times before they can even get out of their bed, or soon after they come home, they have to do certain rituals in order to avoid God from getting angry at them. So they can also be checking if they lock the door. They'll go, come back, pull the lock, make sure it's locked, and then they'll walk away. Then they'll come back again. It can continue constantly up until it is annoying. It annoys them too. And these are some of the examples of OCD symptoms. And obviously, these symptoms are extremely painful for the person who is suffering from OCD. They can also be like OCD related. We talked about checking, and also it could be if they're walking on the street, right? If they go past the manhole, then they need to do 3 circles around the thing or 4 circles, whatever they have this thought process, and they'll be walking away from that. When they come to every manhole, the same ritual has to follow. So it is quite disturbing, very disturbing to the person who is suffering from OCD. And also OCD patients have other related diseases like Tourette syndrome. Tourette syndrome is like saying, it's like a tic. They can even have a vocal tic where they'll be like constantly using obscene, abusive words constantly. The 4-letter words and all those bad words will be like thrown easily. So they have the Tourette syndrome. Tics, they can have the kind of blinking the eyes several times and all those kind of stuff. The movement disorder, Tourette's, they can have kind of kicking, all those kind of movements. Some of them might have constantly keep pushing, or they can even have a pulling of their hair, So all those rituals would happen, and that can cause other complications just based on the rituals that they bring in. So it's important that OCD we treat as soon as we can. And OCD does not freshly develop after the age of 40. Before 40 years of age, one has to show the symptoms. It's very rare that you see somebody suffer from OCD after the age of 40, which is a good sign for the grown-up, right? But that being said, when a child shows the symptom, we should immediately seek treatment because we can fix it. There's no cure. So we will talk and continue about OCD treatment in my next video. Up until that time, bye-bye. Take care.